Welcome to my YouTube video. You can also find this video on my website, www.fixthehealthcarebill.com. Today, I'm going to talk about rescission. Rescission is when an insurance company cancels a person's policy. It sounds horrible when you hear about it in the news, but like so many times in life, you're only hearing one side of the story. Those who have their policies rescinded will sometimes go to the paper and make powerful accusations. You'll hear quotes like, "They canceled me when I got sick," or "they just didn't want to pay my claims." Such accusations are really alarming for all of us who do have insurance. We might ask, what if I get sick? Can my insurance company cancel me anytime I get sick? The simple answer is no. To help you understand the reality in these situations, we need to ponder another question. Why do insurance companies ever rescind policies? Well, the truth of the matter is, there are situations where it makes perfectly good sense. And those situations are when somebody commits fraud. Have you ever filled out an application for health insurance? They ask you a lot of questions about your health, not only to find out if you already have a high-cost condition, but also to find out if you engage in unhealthy behaviors, like smoking or chewing tobacco. Your insurance application goes to the health insurance company's underwriters. These are the people who figure out if you're an insurable risk. They also figure out if you qualify for the best rates, or if they need to charge more to cover a known condition. Let's look at some very common scenarios. Let's say an underwriter is looking at the applications of two healthy people. One person is perfectly healthy. The other has overall great health, except he takes a $50 drug for a very controllable condition. Should these two be charged the same rate? Underwriters increase the rates of some people to cover the cost of their known conditions. Remember, the only difference between these two individuals in this scenario is that one of them takes a $50 drug each month. Otherwise, these two individuals are the same. Keep in mind, insurance is all about covering your risk. For health insurance, it's your risk of getting sick with a horrible disease or suffering a devastating injury. For homeowners insurance, it covers the risk of your house burning down or being hit by a tornado or any other number of catastrophes. Different people are charged different rates for homeowners insurance depending on how much their house would cost to replace and how much of a risk, that is, how much probability there is that this person's house will be damaged. In health insurance, the risks are very different. Here, your rates are based on how much probability there is that you would have an expensive health insurance claim in the coming year. Things like, how likely are you to develop diabetes this year, or to have a heart attack? How about chronic obstructive pulmonary disorder? Let's look back at our example of the two healthy people. These two people probably have about the same risk of developing diabetes or having a heart attack or getting COPD. The only real difference is this $50 drug. If this member wants a plan with a $20 copay for this drug, that means the insurance company is going to pay the remaining $30 every month. So the underwriter can set this person's rate $30 higher than the first person's rate. The rest of their premium covers all the things that might happen to either of these people in the future. So now back to the insurance application. Some of these conditions they ask you about are a lot more expensive than a $50 drug. Things like congestive heart failure are much more costly to treat. Some conditions are so expensive the underwriter could never charge you a rate high enough to cover your expected cost, especially when you add in all the other things that might go wrong with your health in the coming year. The problem is, some people never buy insurance when they're healthy, and when they do get sick, some of the dishonest people lie when they fill out their application. I've seen clear evidence myself of such situations, where people said they were perfectly healthy on their application, and 3 days after their insurance kicked in, they went in for a follow-up visit to a specialist for their expensive condition. This is clearly fraud. Now don't get me wrong, sick people need options. There needs to be a safety net for these individuals, but that answer should not be fraud. What is needed are high-risk pools. I talk about these more in another video, but these are insurance plans run by the government for people who don't qualify for normal insurance. Some states have them. In the future, all states should have them. Or perhaps there should be a federal program, but we definitely have to allow insurers to stop fraud. If you think about it, fraud is basically unfair. Fraud is unfair to all the honest people who paid for health insurance when they were healthy, who bought coverage to pay for them so that they were covered when they got sick. Rescission protects honest people who deserve to pay low rates. These honest people see the rates go up and up each year, partly due to the dishonest behavior of others. Rescission is a protection to prevent that from happening. Again, don't get me wrong. Insurers should only be allowed to rescind policies where there is strong evidence of fraud. Insurers should be required to use applications that ask clear questions and aren't confusing to applicants. Insurers should never be allowed to cancel the policy of a person who became sick after they bought coverage or who had high claims for a condition they were honest about. If the insurer knew about the condition at the beginning, they have to live with the consequences. If you have questions about anything in today's video, please feel free to write me at anonymousactuary@gmail.com, and feel free to check out my website at fixthehealthcarebill.com. Thanks for watching my video, and have a great day.